Ted, tell us about some of the unexpected hurdles that you've had to deal with a complex medical history, and what was that like as a teenager and then transitioning from a teenager to a young adult? Tell us a little bit about that process.
The challenge came going to college because all of a sudden I was on my own as far as the healthcare part is concerned. And the specialists, the oncologists, the nurses that I knew, I had graduated from. I was no longer seeing pediatric oncology anymore. And so the challenge then was trying to find a new clinician when I was in college to go see and talk about my health history, which would have been primary care and general clinicians. But there wasn't any adult pediatric cancer survivor clinics to go to. And so trying to kind of mix those two together and still trying to figure out how to manage a healthcare world was actually pretty overwhelming. And so I didn't go. After I graduated from my clinic with the oncology service, I just didn't go to the clinic for the next 3 to 5 years. And it wasn't actually until I was in medical school learning about complications that I realized that I should be seeing somebody at that time. And much like other peers around me in college, maybe people don't seek healthcare, and that was kind of what I did. But then when I was learning about those issues, that's what really prompted me to actually seek out and figure out what the problems actually were that I should be worried about or looking for, and managing those things too. But no one really brought you through that, and no one really said, this is where you go as adult cancer survivor.
You are not alone. The statistics also show that 1 in 5 young adults who have had childhood cancer get care specific to their past treatments or their health issues. That is a real challenge in our health system and the care that we deliver that a lot of research needs to be devoted to.
My story is very similar. Yep. I finished cancer treatment and went back, for the follow-up appointments until they gave me that cured diagnosis. And then I took my little binder with everything in it and I packed it away someplace and went to college. And I didn't follow up until, I got sick or something like that. But that's also something that I really missed. I wished that there was some kind of a transition into a new healthcare. My story is a little unique in that I moved to a different state immediately following my treatment. My dad actually got a job in Iowa, so I moved to Iowa for a while. And so there was just kind of that transition of states too, and it was hard to figure it all out and navigate it.
Yeah, that's such an area of need for childhood cancer survivor specific research. How does the care move with you? Whether it's geographic or whether it's through different phases of your lives, there has to be a way to do that and do it effectively, because there's just too much benefit that could happen if you that we want to make happen if you're getting that care.
Mm-hmm. The mental health piece, I think that's also something that's really important for kids who have just gone through something like this. Not just the physical piece, but how do I deal with this trauma that I just went through? How do I manage it emotionally? How do I go from being a cancer patient to being back in school with other kids who have no idea what I just went through? How do I go from being bald to transitioning from wearing a wig to having really, really short hair? All of these transitions that happen, that mental health support, I think, is really important to help process through all of those feelings too.
Connor, tell us a little bit about what are some of the things that are maybe harder for you to do or get done than your friends or classmates. What kind of things are like that for you?
Probably mostly when we have a specific goal work to do, and then they have it done easily, and then I just also have an episode and take times off that work. So then I have to take the rest of the like a different hour, like study hall or something, to do that work because of the episode making me not able to.
Tell us more about what those episodes or seizures are like. What do they look like? How do you feel when they happen? Tell us about that.
When I have an episode, I'm basically paralyzed. I'm stuck walking in one direction. I can still see and hear everyone. It's just, I'm like, the episode's just making me not able to do anything until it goes away.
How long do they last?
Just like a few seconds.
And how often do they happen?
Depends on what my emotion is. Like if I stay happy and anxious and sad, I might have an episode. It's just many emotions happening at once.